The Senator from North Carolina, Senator Burr, and I are here to speak about an important and exciting development that's about to occur in our Committee of Health, Education, Labor, and Pensions. What we're talking about, and we'll describe in our remarks today, is a report entitled Innovation for Healthier Americans, which will launch a bipartisan effort to look at how Congress can help to get cutting-edge treatments, drugs, and devices to America's patients more quickly while still preserving this nation's gold standard for safety and quality. This report and the actions that we hope to take will affect virtually every American. And I'm especially glad today to be here with the Senator from North Carolina. While there are a number of senators in this body on both sides of the aisle who've worked hard on these issues, which in our government are usually dealt with by the Food and Drug Administration and by the National Institutes of Health, no one has been more effective, no one has worked harder, and no one has had more foresight and vision on these issues than Richard Burr, the Senator from North Carolina. The report today is substantially his work product, and he'll be deeply involved in the next year as we work with Senator Murray, our Democratic friends, and with President Obama to try to bring this to a result. In 2013, Dr. Francis Collins, director of the National Institutes of Health, wrote the following, quote, "Drugs exist for only about 250 of the more than 4,400 conditions with defined molecular causes. And it takes far too long," Dr. Collins said, "and far too much money to get a new drug into our medicine cabinets. This is an old problem that cries out for new and creative solutions." Since Dr. Collins said that, the number of conditions with defined molecular causes has increased, now to about 5,390. Yet the number of new drugs approved has not kept pace with these discoveries. The President of the United States has recognized this. In his State of the Union message a few days ago, President Obama said this, "21st century businesses will rely on American science, technology, research, and development. I want the country that eliminated polio and mapped the human genome to lead a new era of medicine, one that delivers the right treatment at the right time. In some patients with cystic fibrosis, this approach has reversed a disease once thought unstoppable. Tonight," the President said, "I'm launching a new precision medicine initiative to bring us closer to curing diseases like cancer and diabetes, and to give all of us access to the personalized information we need to keep ourselves and our families healthier." The Senator from Washington, Senator Murray, and I at breakfast yesterday with Secretary Burwell talked with her about the President's statement and about Secretary Burwell's own desire to help implement that. So today, Senator Burr and I released the report, Innovation for Healthier Americans. And next, Senator Murray, who's ranking member of the Senate Committee on Health, Education, Labor, and Pensions, and I will start examining the issues in this report and other issues raised in comments through a bipartisan Health Committee staff working group. I emphasize that. We're going to be working together, Democrats and Republicans. We're going to be working with Secretary Burwell. We're going to be working with the President of the United States, and we're going to be on a parallel track with the House of Representatives, where Chairman Upton and his team have been working for several months on what they call 21st century cures. In our committee in the Senate, we'll begin hearings in March. And we're releasing the report today in order to ask for comments. Surely we missed something in the report, and someone who's listening or reading it may have an idea or solution. We'd like to know about that. We've opened up an email account just to hear from those outside Washington, D.C. That's innovation@help.senate.gov. Innovation@help.senate.gov. Improving medical device and drug development is not a new topic for we call it the Help Committee. Legislation was passed in 1997, was passed again in 2012 to try to get at the same goal of speeding drugs and devices while ensuring they are still safe. Our goal will be to get bipartisan legislation to the President this year. It's encouraging to have the House, the Senate, and the President working on such an important common goal that affects virtually every American during the same Congress. That greatly increases our likelihood of securing a result. We want to improve and modernize how drugs and medical devices are discovered, developed, and approved. We will examine the work of the National Institutes of Health, which funds and enables much of the research that leads to medical breakthroughs, and the Food and Drug Administration, which regulates all the medical products we come in contact with. As I mentioned, this work will touch the life of virtually every single American, from a very ill patient who's run out of treatment options and is counting on the most cutting-edge drug, to an active child with asthma who's hoping to run faster and farther with the aid of a new drug. Today, our scientists and researchers are making discoveries at a pace that our development progress is not equipped to match. Patients wait while treatments languish in laboratories, going through our drawn-out, inefficient, and outrageously expensive development process. FDA Commissioner Dr. Margaret Hamburg has acknowledged that, quote, we are left relying on 20th century approaches for the review, approval, and oversight of the treatment and cures of the 21st century, unquote. There's no time to waste in solving this problem, Mr. President. The mapping of the human genome opened a whole new world of individualized medicine, in which a person's genetic makeup can drive the doctor's plan for disease prevention, diagnosis, and treatment. In the words of Andrew Eschenbach, the former commissioner of the FDA, director of the National Cancer Institute, quote, we stand on the cusp of a revolution in healthcare. Advances in molecular medicine will allow us to deliver powerful new treatments that can cure or even prevent diseases like Alzheimer's and cancer. Tomorrow's high-tech cures can also slash healthcare costs and eliminate ineffective treatments. What will it take to realize the potential of the new medicine, he said. Today's report is the first step of our initiative. It seeks to answer the questions: what today is driving innovation, what barriers are standing in the way, and what can we improve? The report has 5 main themes. Number 1, it costs too much to bring medical products to patients. Number 2, as science and technology advance, the discovery and development process takes too long. And number 3, the Food and Drug Administration's responsibility have grown to include many responsibilities that are unrelated to regulating medical products. 4, science outside the FDA is moving at a faster pace than ever. And 5, an effective FDA is essential to maintain the United States leadership in biomedical innovation. Mr. President, I ask consent to include in the record the remainder of my remarks and a copy of the executive summary from the report that Senator Burr and I are releasing today.
Without objection.
And Mr. President, I now would yield the floor and look forward to the remarks of the senator from North Carolina, who, as I have said, has done, well, let me put it this way, no senator has done more on either side of the aisle in this area of helping us think about creative new ways to move treatments, medical devices, and drugs through our safety process into the medicine cabinets and into the hands of patients who desperately need them. Thank you, Mr. President.